Thank you, Mr. Speaker. And I rise in firm support of this bill. This is a bill that's time has come. Thanks to Representative Baker for his years of work on this issue at the state capitol, working with various stakeholders. And thank you, too, to the families who have been here for hearing after hearing. And I know that they're here in the gallery today. And there's been many times during the discussion that I've looked up because they really give a lot of perspective to what's at stake here. The families of Minnesota are at stake. And one of the things that strikes me so strongly when these families show up who have lost children, and I'm raising my 11-year-old, and it's clear to me that they're here in their loss to save our kids. They're here to make sure that my kid and your grandkids are safe and have the resources they need to prevent ever being addicted to opioids, to provide treatment to people who are suffering addiction. They're speaking for our kids out of the loss of their own. And that sits in my heart, and I think about these families all the time. And I also think about responsibility. And we talk a lot about responsibility here at the Capitol. And I'm troubled. And I'm troubled when I hear that the people who made these drugs, that the people who chose to falsify studies, to falsify research and tell doctors to expand their prescribing of opioids. As Representative Baker said, opioids have been around and have been part of treatment protocols for decades. But there was a concerted effort on the part of pharmaceutical manufacturers to make sure that more opioids were going out the door to the tune of billions of dollars. You look in the early 1990s, before this really got off the ground, and pharmaceutical companies began to specifically market new uses for opioids. For chronic pain, they claimed that people with chronic pain couldn't get addicted to opioids. Do we know that that's not true today? You bet we know it. Are people still suffering addiction? Yes. And then in the 2000s, in the late 90s, as Representative Baker said so eloquently, they found a way to deliver that drug more effectively. And we know, because a lot of these folks are getting sued through discovery, not only did they work to addict people, but they tried to blame the addict. How can they figure out how to blame the addict for their addiction? How can we figure out how to make this about crime and about people's bad behavior and not about the fact that they're addicted to a drug that was prescribed to them by their doctors? And so opioids became less available, treatment protocols, prescribing protocols began to change, and the black market started to open up. And we see families that are being hit with deaths from heroin, families in our suburban and rural communities. You know how we talk about the Midwest, salt of the earth. And these families are being hit with an addiction to a drug that we could never imagine. And then they started turning out synthetics like fentanyl. Now fentanyl, you didn't even ever used to hear about fentanyl as a drug that anybody took outside the hospital. That was given to you in the hospital, but that moved on too. Synthetic opioids have moved on. And people are dying. I just added it up again, and I had to check my math with Representative Olson because I can't believe this number. In 2017, 442 people in Minnesota died of opioid addiction. They died of overdose deaths. What a horrible, horrible way for families to lose somebody. And we're wringing our hands and wondering what to do when the science tells us exactly what to do. The science tells us, do what Representative Olson put in her bill. Do what Representative Baker put in this bill. have a multi-pronged approach, which we have done. We have changed our laws around Narcan. We had to come into this room and vote to make sure that Narcan was available to all EMTs in public spaces because it saves lives. But what's the underlying problem there? It's the addiction. And it's the fact that when you're addicted to opioids, your risk of death is much greater than with other drug addictions. The stakes are far too high for us not to pay attention. And some people talked about that this is going to cost more because we're going to charge a fee to these manufacturers. You want to talk about cost? Talk about the $16 million that one health plan in Minnesota had to spend on opioid addiction. One. Talk about the $400,000 additional spending that we had to spend through medical examiners' offices in Minnesota because of deaths from opioid. That's the way our general fund money is being spent. And the thought of putting more of that responsibility on the taxpayers and not asking the folks who marketed these drugs to doctors, not asking the folks who made these drugs and made billions, billions and billions and billions, whether they were part of the conspiracy to try to grow this market or whether they just raked in the money themselves, this is part of the problem. So for us to ask for them to pay just a little bit so that our healthcare system can cope with this crisis, so that our state government can cope with this crisis, so that our county can cope with this crisis, makes perfect sense. Look at the way we've done it before. The tobacco companies have had to pay, and you know, we actually sunset part of what we collected from the tobacco companies because Clearway, Minnesota is going away, and we know that tobacco use is on the rise. And so making sure that Minnesota is in a good place before this, something like this sunset makes a ton of sense based on our state's experience. And I think one of our committee hearings, we heard a law enforcement representative who was there, and the pain on their face is just unbelievable. You know, these are the folks that have to go to somebody's house and tell them that their loved one is gone. And he spoke so eloquently, and one of the things he said, which really struck me, he said, remember that when people died taking Tylenol? And I had to go and Google it because I remember that distinctly, and it felt like it was widespread and all over the country. I was a kid at the time. It was 7 people that died in Chicago from those Tylenol deaths. And what did the drug manufacturer do when 7 people died? Every pill was pulled from the shelves. Every pill was pulled from the shelves, and nobody said, boy, it's going to increase healthcare costs because we're not going to be selling this. Every pill was pulled from the shelves, and nobody said, boy, I'm really worried about the stockholders of this company. Every pill was pulled from the shelf because people were dying, and action had to be taken. Now, we're not asking for people not to have access to opioids. We're not asking for people not to have access to medicines that they need and that their doctor prescribes to them. We are asking for these companies that helped manufacture this crisis in our state and around the country and around the world to be part of the solution and join us and help our counties and help our state and help our citizens to get ahead of this crisis and make Minnesotans safe again.